Hello, my name is Freedom Martin, and I'm going to be comparing long-term care in Japan and the United States. Our agenda for this presentation is to first introduce you to what long-term care is. Next, we will discuss what long-term care looks like in the United States, and then what it looks like in Japan. Afterwards, we will compare the two, providing an overview of the strengths and weaknesses of each. Finally, we will talk about how long-term care has been affected by and how it has adapted to the COVID-19 pandemic. Shi and Singh describe long-term care as a health service that is provided to individuals that need to be assisted for long periods of time, such as those with disabilities that affect their self-sufficiency to a point where they cannot take care of themselves indefinitely, or those who need to be cared for in a specialized environment, such as a person suffering from dementia. Long-term care can occur in facilities designed specifically for providing it, but a lot of long-term care occurs in an informal setting, largely at home. The primary group served by long-term care, or LTC, are older adults. The majority of older adults are in good health, but aging naturally causes an increase in the likelihood of degenerative diseases such as Alzheimer's to occur. According to Shi and Singh, as a person ages, chronic ailments, comorbidity, which is multiple health problems, disability, and dependency tend to follow each other. The private nursing home industry appeared in 1935 in the United States with the enacting of the Social Security Act. By 1950, licensure was required of nursing homes. In 1965, Medicare and Medicaid were passed. Medicaid caused a bias in favor of using institutional care by covering LTC in institutions but not at the home. In 1974, LTC facilities were required to meet regulations such as properly qualified staff and fire safety, and these regulations became enforced. 1982 saw the passing of the Katie Beckett Medicaid State Plan option, which covered children with disabilities in the community rather than only those who were in institutions. In 2000, the Americans Act Caregiver Program authorized state grants to fund a range of supports that assist family and informal caregivers to care for their loved ones at home. In 2010, the Affordable Care Act was passed. The next year, the first of the baby boomers reached the age of 65, signaling that an increase in older adult care needs was around the corner. In 2015, the five-star quality rating system for nursing homes was revised, thus raising performance standards. As touched on a moment ago, the baby boomer population is now entering the elderly stage of life, which, as previously discussed, is when long-term care becomes the most important. Additionally, long-term care provides support to individuals that may be incapable of supporting themselves. Without long-term care, the population that requires it may be hard-pressed just to survive. Keeping in mind that long-term care really encompasses any sort of lasting health care, even on the informal level, it's also difficult to even conceive what a lack of long-term care would entail. Over 12 million people need some form of long-term care in the United States. Slightly over half of this population is over 65 years old, and almost 500,000 are children. It is estimated that around 80% of the population require long-term care in the United States receives it exclusively on the informal level, i.e. from unpaid caregivers such as family members. Of the 20% that receive some formal care, 70% get a mix of formal and informal care, which means that only 6% of the population receives exclusively formal care. This is somewhat of an interesting trend to be observed in the United States, which has one of the most individualistic cultures on the planet. Americans are more likely to put the self before the group and put value on independence and autonomy. This is not necessarily a negative thing, it's just a hallmark of the American cultural atmosphere. With this individualism in mind, it's somewhat counterintuitive that most long-term care occurs in the community informally rather than in institutions. For those that are receiving care from institutions, a variety of services are available. In fact, the very nature of long-term care necessitates a wide diversity in services offered, because each individual that requires long-term care has a unique set of needs. A large part of long-term care service revolves around assisting in ADLs, or activities of daily living, such as going to the bathroom or getting dressed. Also offered by caregivers is assistance with instrumental daily activities of living, which means things like housework, managing money, taking medications, and going shopping. Services that are specific to the individual may involve specifically dealing with the condition that causes them to need long-term care. For example, recovering from a surgery may be a cause for someone to need long-term care, and a specific service may be cleaning surgery wounds and refreshing bandages. Policies in the United States include Medicaid and Medicare. Both offer financial assistance to different populations. Medicare offers some benefits to skilled nursing facilities and home health provision, but Medicaid is where much of the funding for long-term care comes from. Medicaid funds long-term care for people with low incomes as well as those who become poor due to medical spending, and at least partially covers around 2/3 of all nursing home residents. Additionally, Medicaid can cover personal care at home. Another example of policy regarding long-term care is the aforementioned Americans Act Caregiver Program, which helps provide funding to long-term care in the home. Just like in the United States, about half of the population in need of long-term care is comprised of older adults. Also like the US, a large portion of the population is now becoming elderly, meaning the need for long-term care is likely to increase in the coming years. One difference in population is actually seen with the caregivers, which are mostly women. Another similarity between the two is the focus on community care. The services offered are not much different either due to the nature of long-term care. The main differences between the two countries arise in policy and delivery of care. In Japan, it is not uncommon for professional healthcare providers to care for clients in their own homes and/or to assist in formal care. The Japanese system provides more of a care continuum from the home to the nursing home. In the past decade, home and community-based services have grown much more quickly than facility use, 203% growth to 83% growth respectively. Long-term care and healthcare have separate insurance systems. At the age of 40, individuals are required to start paying for long-term care insurance, and they may begin accessing limited services at this time. At age 65, they gain full access to LTC services after an assessment to determine needs. One strength with Japan's system is the continuity of long-term care across different settings. It's more common for formal care to occur at the home or on the community level in Japan, which as a result provides individuals needing care with a more comfortable, natural setting while also allowing them more autonomy. Japan also has more complete coverage due to requiring individuals over the age of 40 to pay for long-term care insurance. The United States has a strength in Medicaid, which offers a safety net of sorts to people who are financially burdened by health costs. This helps to alleviate concerns regarding the cost of long-term care. Medicare also helps fund home care and facility care. Both countries face a similar problem regarding costs, namely, demand and costs are increasing at the same time. This takes up financial and medical resources that could otherwise be allotted elsewhere in the healthcare field. As Japan and other Eastern countries have become more industrialized, there has also been a cultural shift away from familial piety. Younger generations are not only feeling less obligated to care for their elders, but less like elders should be respected for their age alone. Long-term care in formal settings is helping to alleviate the resulting increased need, but cannot easily answer the resultant rising suicide rates among elders. The United States also has a weakness in coverage. Not all of the people in need of long-term care have access to it, and those who wish to stay out of facilities may, as a result, receive less skilled care from family members. In the United States, state and county departments of health, as well as the CDC, have quickly begun to produce resources that function as guidelines for LTC facilities. For example, the CDC offers guidelines to keep COVID-19 from entering the facility, such as restricting visitation, and also provides steps for identifying infection early and preventing spread throughout the facility. However, a quick literature search reveals that little information is available on the effects of COVID-19 on informal long-term care, nor are resources offered to help informal caregivers adjust. This indicates that there may be little adaptation occurring, and the response from informal caregivers is likely not organized. This could leave informal long-term care services vulnerable to turmoil in multiple ways. Namely, if the virus enters the home, there may not be a strong action plan in place, which is problematic because the individual needing care, or even the caregiver themselves, may develop serious symptoms, and spread within the home may also occur. Japan's long-term care system has also been struck quite heavily by the pandemic, as is the case with much of the world. Problems reported in Japan include facilities becoming hot spots for transmission, which is obviously a big problem considering the severity of symptoms in older adults, staff retiring suddenly in an attempt to avoid being infected themselves, and overburdening of care providers stemming from school closures. As mentioned earlier in the presentation, a lot of the care providers in Japan are women, which is the same population typically caring for children outside of the school. With students no longer attending school, women are having to forego long-term care provision in favor of caring for their children. In both cases, systems are scrambling to respond to the pandemic. This illustrates how important it is to have a plan for events even before there's a reason to expect them, i.e., if strong action plans had already been created for what to do in the event of a highly transmissible pandemic virus, there would be a stronger response due to having time to prepare. This observed unpreparedness is not just seen in long-term care facilities in the US and Japan. Rather, much of the world demonstrates such an underpreparedness. Any publications information was gathered from for this presentation are listed here.